This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.
Good afternoon. My name is Helen Collis. I'm a healthcare journalist at Politico, and you're watching Politico Live, the live extension of our journalism. I'm coming to you from the Residence Palace in Brussels, where today we'll be delving into the issues of medicines shortages. Drug shortages have been plaguing Europe for years, and they've been getting increasingly worse. The pandemic showed just how bad things can get when demand for medicines surges and supply chains are interrupted. But even as the pandemic eased, last winter saw some of the worst shortages Europe has ever experienced. From antibiotics to children's cancer drugs, some countries were reporting hundreds of products in short supply. A survey of pharmacy groups at the time revealed that shortages had even been linked to deaths. Today, new EU measures are now being implemented by the European Medicines Agency to map out medicines most in need, so that their supplies can be monitored. This work builds on the agency's crisis response to drugs shortages during the pandemic. And by the end of the year, the agency should have established a list of critical medicines for special monitoring. In addition, the European Commission published late last week its long-awaited proposed overhaul of the pharmaceutical legislation, and this includes several measures designed to prevent drug shortages. Companies at risk of stockouts will need to notify authorities earlier. They will also be required to create shortage prevention plans. The EMA will be given more power to coordinate action on shortages, and the Commission may decide that companies or other bodies must hold stockpiles. But despite these plans, a majority of EU countries has already come out demanding more. 19 EU countries co-signed a paper this week calling for further EU legislation to ensure the security of supply of medicines. Today, we'll be discussing whether the EU's proposed measures go far enough to avert another crisis as we saw last winter, and whether more needs to be done to address the underlying causes of shortages. But first, we have some housekeeping remarks. I would like to thank our partner, Teva, for making this event possible, and for our audience for joining us online. We would like to make this event as interactive as possible. You can participate by tweeting about it at LivePolitico and asking questions through Slido using the hashtag MedsShortEuropeEU. I will be prioritising questions sent with a name and organisation so our panellists know who they are addressing. You can already share your thoughts and answer the following poll presented by Teva. Which policy measures would you prioritise to ensure security of supply of medicines in Europe? And you've got 4 options there. Before we go, we will look at the results at the end of our panel. And before we get started, we'll now hear some opening remarks from our partner, Philippe Dreskel, Vice President of the EU portfolio at Teva. Philippe.
Gathered to address a crucial question: is Europe on the right path to prevent medicine shortages? Access to medicines plays a vital role in our lives. It's a question of utmost importance. Today, our aim is to share key data points and help convene a conversation to examine and help addressing the problems of shortages. As Vice President of Teva Generic Portfolio Europe, I am proud to represent a company that is a leader in generic medicines. Our mission is to improve lives through access to high quality and affordable medicines. This commitment, deeply embedded in Teva's DNA, is especially important considering the concerns we have witnessed over the past years regarding shortages of essential medicines in Europe. We live the reality of these issues in real time every day. And let's look at those realities. To launch this panel discussion, let me share with you the outcome of a new analysis that we conducted recently looking at generic market data. and which reveals that over the past 10 years, despite increased affordable access to medicines for patients, generic competition has decreased dramatically. The analysis shows that 69% of generic medicines have today just 2 or fewer suppliers, and 26 of generics approved 10 years ago have disappeared from at least one European country. The decrease in competition directly challenges supply and reduces options for patients. The situation is even more dire in life-saving areas like antibiotics and oncology generics, where 33% and 40% of medicines respectively have left at least one European market. The issue is systemic across Europe. We have known this anecdotally. Countries across the continent have reported shortages. Now we know where that lies in life-saving medicines, including antibiotics and oncology drugs. These medicines, many of which are part of the WHO essential list, are the backbone of Europe's medicine cabinet. Just a couple of years ago, the COVID-19 pandemic was still underscoring the importance of these drugs. However, securing their supply is proving to be a challenge. The generic market is under pressure from the impact of post-pandemic inflation, the ongoing energy crisis, and increasing cost of production. As the production of active pharmaceutical ingredients moves to the east, where it costs between 20 to 60% less to produce medicines, Europe is losing gradually its competitiveness and its strategic autonomy. This is creating increasing supply vulnerability in Europe. The driving forces behind this decrease include a race to the bottom on pricing and an onerous regulatory regime. And to address these issues, we urgently need policy reforms, both at national and European levels. First, we must support pricing action at the national level to increase the economic viability of essential medicines, which for some are priced lower than a pack of chewing gum, despite their high technological value and the know-how they integrate. We see some positive measures happening in Portugal, for example, and in some other countries, but not systemic enough to stop the drain. Second, we need a pan-European environment that helps us prevent shortages by reducing regulatory costs, increasing transparency of the demand and supply of the whole supply chain, ensuring a constant two-way dialogue between the industry and regulators, and ambitiously introduces the e-leaflet to help move our stocks across the single market. As shown during COVID-19, shortages is often less an issue of how much medicine is available and more where they are in Europe. The Critical Medicines Act proposed by 19 member states under the leadership of Belgium is an important and welcome step forward. Now time to act. As we engage in today's discussion, let us work together to address the dynamics affecting Europe's essential medicine cabinet and find ways to ensure that patients keep full access to the medicines that they need when they need them. Thank you for your attention, and I look forward to an insightful and productive conversation.
Research that you've done there. So joining me today on our virtual panel discussion, we have Adrian van den Hoven, General Director of Medicines for Europe, Daria Karuch-Polja, Vice President of the European Association of Hospital Pharmacists, or EAHP, MEP Katarina Konečná from the Czech Republic, a member of the COVID Committee and of the Subcommittee SANT, and Professor Gilles Vassal, a board member of the European Society for Pediatric Oncology, or SIOP Europe. Welcome all to the panel today. Gilles, I'd love to start with you first. You're at the coalface of dealing with medicine shortages. Can you explain for us what it's been like in recent months and years? What impact have medicine shortages had in your field of pediatric oncology?
Thank you very much. The issue of access to essential medicine is a critical issue for all professionals in pediatric oncology and parents. We have conducted a survey across Europe about what was the accessibility, availability, affordability of essential medicine to cure children with cancer. And in this survey, we identify that some drugs had a high level of shortages. An example is asparaginase, a drug which is essential to cure children with acute lymphoblastic leukemia, with a hope of cure for 80%. And this was the drug with most frequent shortages over the last 2 years. And in addition, inequalities across member states about the availability of these medicines. And on a daily basis, the pediatric oncologists and the pharmacists in the hospital really try to do best to find an alternative solution when the drug is missing. So yes, shortages can impact survival of children and adolescents with cancer, as it can impact other patients really needing these drugs for their treatment.
That sounds incredibly challenging to deal with for all involved, doctors, patients, parents, physicians and pharmacists. As a physician, what kind of insight do you have into medicine supplies? Is it easy to find out what's going on and where you can get the medicines that you need?
Well, actually, the physician on the ground prescribe a drug for their patient, and then the physician try to find out how to deliver the drug. And then we hear from the media that, well, there are shortages of amoxicillin, of paracetamol, and so on. So clearly the awareness on a daily basis is not something that is clear for all physicians.
I see. And I'd also like to bring Daria in at this point, because you're also, you know, as a hospital pharmacist, very closely linked to these issues. And in fact, back in 2012, your association actually published its first position paper on drug shortages. Even back then, the association was calling for the Commission to urgently investigate the factors causing drug shortages and to propose solutions to alleviate or solve the problem. Here we are over a decade later. We now have the Commission's proposals, as put out last week, and the European Medicines Agency drawing up a critical list of medicines. Do you think these measures go far enough to prevent further shortages?
Hello, good afternoon to audience. Good afternoon to Helen, and thank you for having me. So we were one of the first associations that raised the problem of managing medicine shortages, because a lot of the times hospital pharmacists are managing and mitigating shortages without physicians and patients being aware of it. So we are all in line with wholesalers in industry, and not a good thing, but from COVID-19, this problem of medicine shortages became a hot topic that we are discussing today. And I also wanted to share, as you already said, that we launched the first survey of medicine shortages back in 2013, and now in 2018, 19, and during the COVID. And we were investigating the impact of hospital pharmacists' everyday job they have in mitigating medicine shortages. And 2/3 of hospital pharmacists, so more than 1,000 hospital pharmacists and from 35 European countries participated in each of this study. They said that they experienced drug shortages on a weekly basis, which led to delays of care, medication error, suboptimal treatment, transfer of patient to facility where medicine can be provided, and some reported even death, which was also in line with the study that was published in US that which showed higher mortality among patients with septic shock in US hospital, where was norepinephrine shortages despite having alternatives such as phenylephrine. This is just want to emphasize the problem of shortages. And now during the COVID, this problem has increased. And the good thing that European Commission has already before having pharmaceutical legislation to do some good measures, such as having HERA, then having more competencies for EMA, which established the group that manages medicine shortages. But there is also a lot that in pharma legislation has to be done. For instance, to say how much, or maybe to give some form of incentive to industry when the industry can predict the shortages of, for instance, when they have the problem in production. I know it's really hard to predict that, but maybe to put them on the white list. There are some examples from the US, but I think there should be something put forward to motivate not just industry, this is some example, but all of stakeholders included in the process in order to mitigate the shortages.
Thank you. You've raised some really interesting points, and I will come back to some of those. But first, Katerina, I'd love to bring you into the discussion. I'd love to get your reaction to this. First of all, pharmacists have been really trying to manage this on their own for many years and raising the flag that this is a big problem. One of the committees that you sit on, the subcommittee for health, has recently discussed drug shortages and spoken with the most powerful healthcare leaders in Europe about it. Emma Cook at the European Medicines Agency, Stella Kyriakides, our Health Commissioner in Europe, and Pierre Delceau, the head of the Health Emergency Preparedness and Response Authority. Is this a pivotal moment for Europe in really finally getting to grips with this? And are you convinced by the measures that they are working on?
So thank you very much for invitation, the first, and thank you very much that I want to be with you today, and so special with you, Helen. If we discuss about, or how to tell you, we waiting 10 years or last 3 years for pharmaceutical strategy, and I consider the proposal highly sufficient to effectively fight the problem of the medicine shortages. Yeah, this is what I need to tell you, because if somebody is speaking about the pharma package and about something which coming from the European Parliament, realize that we are currently experiencing huge medicine shortages problems and shortages of base antibiotic, drug against cancer or diabetics. This legislation will obviously not help us with these shortages. That means that I think that now is nothing in the hands of European Parliament, because I will be in a new European Parliament. It will be completely new. Everybody will be new, and everything starting from the beginning. Yeah, that means that if somebody coming with a big pharma package the 1 year before the European election and thinking that find a solution in this package, especially so sometimes with the medicine shortages, it's impossible. And for me, it's most important the letter, a non-paper letter from the Council from yesterday, from some member states from Council, because it's really, really interesting that, and this is something which is missing me in all pharma package. Yeah, this is maybe the most important. And if we find solution for shortages, I think that we, for me, it's better to speak with the Council and with the member states how to push the Commission in from their side, not speaking about the pharma package, which not will be for these days, and which isn't I don't know, maybe start after decade, not earlier. Yeah, that means that in European Parliament is now a situation that we will discuss. We invite Stella and all people from HERA, EMA, and so on. The package is big, it's fine, that's coming. But in the other side, nobody thinking that we find solution in this package about currently medicine shortages, what we now need to, where we now need to find solution in the member states.
Thank you. Adrian, you are our industry rep here. I'd love to get your response to some of the comments we've had so far this morning. It sounds, especially from our MEP here, Katarina, that the proposals that the Commission's put forward are not really up to scratch.
Yeah, thanks a lot, and thanks a lot for inviting me to participate in this. I think, like the other stakeholders on this webinar, we've been talking about working on medicine shortages for a few years now. Obviously, during COVID-19, where you had a massive surge in COVID infections, of course, and massive surge in demand for certain medicines kind of flowing from that, we also experienced live some of the real challenges we face in Europe. When it comes to the pharmaceutical legislation, I would agree that it doesn't cover the whole picture, but there are some positive developments in there as well. So let's start with those. I think one good thing is that the Commission is proposing to harmonize the definition of critical shortages, and which may sound anodyne, but it's very important because 9 out of 10 shortages in Europe are actually in one single member state. It's exceptional to have it being a European-wide shortage like we had with antibiotics this winter, or like we had during COVID. And so having this definition will enable us to pinpoint in which member state is the real shortage, not the noise about a shortage, but an actual shortage. And if we have this information, the industry can reallocate with certain flexibilities, with things like digital electronic product information instead of paper leaflets like we have now. You'll be able to move stock around more efficiently to solve that kind of shortage. So that's really a step forward, I would say. It sounds like something small, but it's actually quite critical. What I think is missing, and was pointing out, and I think the European Parliament has made this very clear on many occasions, as well as the Council. First of all, we need to look at what is a sustainable industry. There's nothing really focused on the fact that 70% of the medicines are generic, 7% of prescription medicines are generic. They're very, very cheap. You can see a cup of coffee and a pediatric form of antibiotic in the background photo here. And you can see the price difference between the two, with surprisingly the coffee being the more expensive one. This is telling us of a problem where policies in member states have gone too far. This has driven a lot of consolidation and globalization or delocalization of production, and not to the benefit of security of supply. So I think the Belgian paper, supported by 19 or so countries, is really saying, look, we need to shore up our manufacturing and deal with the sustainability of manufacturing in Europe. That's really a good thing. The other piece that's missing, I think, from the pharma legislation is how do we predict and prevent shortages? COVID-19, the antibiotic shortages this winter, those were based on huge surges in demand. For COVID-19, up to 900% increase in demand for some medicines. For these antibiotics for children, it was 300 to 500% increase in demand. That's huge. Could we not do a better job of predicting this? Can we not work better with the European Center for Disease Control? Can we not use the data we have from the EMVS, which is an anti-counterfeiting system, to see where consumption is rising suddenly, so that companies might have 2 weeks, 3 weeks, 1 month to be able to adapt and better resorb the situation in the future? I believe so. Unfortunately, that's not yet included in the proposal. Hopefully, we can work with the Council and the Parliament to achieve these kind of improvements.
Great, and I just want to bring you back to the letter that the non-paper, as it's called, that we saw this week from the council members, 19 of them. The pharma package doesn't contain any incentives as it stands for the rebuilding up of manufacturing in Europe. Do you think it should have, or do we need another legislation in Europe to really focus on this in the same way that we have now got for microchips? That's for you, Adrian. Yeah.
So, yeah, I believe so. I agree with the proposal from the Belgian non-paper. Why is that? Because so our industry has invested privately post-COVID. So we have invested in new active ingredients, medicines, and biologics plants in Europe. But it's not enough. So we need to work with the EU to leverage some public funds to, let's say, strengthen what the private sector is investing. Unfortunately, under EU funding rules, that's next to impossible to do when it comes to a lot of the legacy prescription medicines, which, as I said, are 70% of the medicines that people are prescribed. So we need a special legislation to enable this industry to co-invest with the EU to reinvest in the manufacturing medicines in Europe. I think it's super important because as everybody knows, a lot has been delocalized to India and China. We can't produce everything in Europe, but we can certainly rebuild and produce more and have more open strategic autonomy, as the Commission likes to call it.
Thank you. And Katerina, Adrian touched on pricing models as being one of the reasons that the sector has become so consolidated. What is your view on sort of reshoring and rebuilding up manufacturing at home, and what impact it might have on the cost of medicines in Europe?
Yes, it's a great idea, and I think that all my colleagues and me support it. But the trouble is that there is in a package what we have now in a table, and I know that in my paper the council or the member states won't. But if I see the pharma package, there is no solution to return of the manufacturers of the pharmaceutical ingredients back to the EU. Yeah, therefore the depends on the China and India will stay. It's reality. If I see all the pharma package, there is nothing about it. And in addition, there is no solution on the market. Failures and shortages caused by the re-export of the medicine from member states with their lower price to the countries with the higher price level. This is a second big issue, and I'm from the Czech Republic. And believe me, that re-export is something which really not help us. And because for Commission is re-export something which what it's possible, it's really crazy. So yes, I think. From my side, it's now better to take it at a non-paper where you could read that it's so about this topic and so about some solidarity mechanism, more than say that we have a pharma package, because in pharma package on this we don't see nothing about this trouble. And I think that we now find solution in pharma package with it. So that means that if Commission not coming with something more, we need to use the non-paper from the Council. And I think that we're using, so especially in Stand Committee, I hope that we will discussing in a next meeting and with the colleagues, so between the groups.
Well, health ministers are meeting tomorrow in an informal meeting, and drug shortages I know is on the table. So that's it'd be interesting to hear if, afterwards if that was that non-paper is mentioned. Daria, as a hospital pharmacist, we've talked about the potential for rebuilding up manufacturing of active ingredients and generics in Europe. Your members are dealing with the challenges of having to source alternative medicines every day. If companies do start to develop more ingredients in Europe, it's likely to push up the prices locally of generic medicines. Is that something hospitals and pharmacies could cope with right now? Is it even feasible given the healthcare pressures and tight budgets?
This is really a tough question to answer, because we are dealing every day with finding solution to get the as cheapest medicine as possible. But as you see from Adrian's example, they are really cheap. So there has to be another solution in how to, for instance, reduce the consumption of healthcare healthcare. How do I say, facilities. And it's not by reducing the consumption of medicines, but using them strategically. So in my opinion, even having higher prices of medicines when they are produced in Europe, not just active pharmaceutical ingredients, but also other things that are like packages. This could mitigate even higher prices when we are paying, when the shortages occur, despite having some legislation on not having too big price. But during COVID pandemic, we took all that we could just to treat our patients. We didn't consider any price of the medicines, for instance. So therefore, it's really difficult to cope with low prices, and I definitely agree that the prices are really small in Europe. In my opinion, there should be some strategy on joint procurement, but not just focusing on lower prices, which leads to more shortages. Especially if this joint procurement is at national level, when for instance, procurement or tender stops, then there is no medicine on the market which won the tender, and there are no generic or alternatives medicines because they didn't have a financial plan to invest, as they didn't pass the tenders. So also prices of medicines should be consolidated, not to be too high or too low. And so, but I think pharmaceutical legislation is on good route to open these kind of discussions and to come with solution, because for European Commission, it's really difficult to do this all alone. In my opinion, we need to do all this together to come up with plan to see what we have to do and what, because when national tenders were ongoing, it was a really good plan, but unfortunately we experienced a lot of shortages, so we have to come up with another plan.
Thank you. We have lots of questions coming through on Slido, so I'm just going to bring in one of the questions from the audience at the moment online. It's actually from Thomas Horland, so he doesn't say who he's with. He says, the US, through BARDA and others, has been funding domestic API production to avoid dependencies, e.g. flow. I'm not sure what that is. Is there a role for HERA to fund new players in the European Union? Adrian, what's your thoughts on that question?
Well, I think they may be talking about a special kind of chemistry, which is continuous flow technology, which can work in some circumstances. It can bring benefits. In other cases, it's more difficult. It's more difficult in many European generic markets because this is like a stop and go market. You win a tender, you lose a tender. So this continuous flow doesn't necessarily work so well there. But anyways, it's a useful technology, so I don't want to criticize it. I'm a little bit more skeptical as to creating all new companies out of state or EU budgets. I know they've done that in the United States, but I'll tell you why I'm skeptical, because in Europe, we actually have a fairly big active pharmaceutical ingredients and pharmaceutical manufacturing sector with a lot of small companies, and those companies have a track record on quality. So they have a very reliable and positive track record on quality. In fact, if you look at the US FDA, which sometimes publishes these statistics, you see that European companies are ranked very high in this space. And so by investing in some of those smaller companies with a very high, or even bigger companies with this very high quality rating, you have an assurance that you're going to invest in companies that can really do this well and meet the quality standards that you need to supply the European patients, because in Europe we have ultra high quality standards, which is a good thing. So my personal perspective is it's better to invest in, say, some of the smaller companies or some of the more established companies that have this really good quality track record, because then you're guaranteed. With a new company that's created from scratch, you have no guarantee whatsoever that they're going to be able to meet the quality standards. If they don't meet the quality standards, you won't get any medicine.
Daria, are you nodding there? Did you want to come in? Daria, I think you might be on mute.
Sorry.
That's all right.
Sorry. I just wanted to say that by this example, so we ensure all the companies to come up on the market in Europe, but they also have to have some quality, as Adrian said. So this is the way also not to have just big players on the market, but to ensure the small ones as well. I like again, I have a US example about startup companies, because but investment is more into US in startup companies and not, unfortunately, so much in Europe, because we are so dispersed all over the Europe. But in US, we all have Silicon Valley. So maybe to come up with some kind of solution, because it doesn't have to be really big investment at once. It just can be with a plan and with a strategy we can follow, and then we can have a more strategic places that produces the medicines in Europe, and also, of course, to include experts from the field, such as patients, healthcare professionals, and industry. So as I already I repeat myself, we have to have a multidisciplinary approach to this problem.
Thank you. We touched earlier on the price of medicines.
May I comment as well, please?
Yes, Gilles, come in. I was just about to ask.
I'm sorry, but I think the voice of the physicians and the parents is extremely important, and not only to say we miss drugs, but really to contribute. So if I may, 2 short comments. The first one about relocation of manufacturing in Europe. We heard as physicians and citizens that it is important. And just give you an example. I took asparagine as an example. There are recent experience in Italy where there was no drug available and they had to import drug from India. And clearly this drug was not the quality required, with the consequences of toxicity and efficacy. So yes, relocating drugs in Europe, we believe that it will increase the quality and the assurance of the quality. Second, if I may, importance of contribution of physicians and parents to all this initiative. It should not be only a technical topic addressed by pharma regulators and so on, because we can contribute. We can say these drugs are essential. We can contribute to the critical list of medicines. And I think it's important to have a multi-stakeholder approach, really to be sure that all together we can find a solution to reduce shortages across Europe, with one important point you made, which is there are inequalities in shortages across Europe. Sorry for that, but I thought it was important to share. Thank you.
Absolutely.
Yeah,
Thank you.
I'd just like to react quickly that I actually agree with what Professor Gilles Vassal has said. He happens to work in the space of pediatric oncology, which is very at risk of a shortage situation. Why? Because these medicines are highly potent medicines, so they have to be produced in a special kind of factory, and they are small volume, so there's not a big volume of production. So consequently, these are, particularly important. So the kind of work that I'm not sure if I should say academic community or physician community has done to create a list. I know it's not official, but that kind of list is super important to try and dedicate and make sure that we don't have shortages in this critical space for that category of patients. So I think he's right, also from the industrial perspective.
It is official and published.
What was and Katerina?
Yes, just shortly back to the question. So I think that the all cause is about high prices of medicine, and somebody would have to pay it. Yeah, and you have a two-way. Either it would be the patients, and that is something which is for me unacceptable as for left MEPs, or it will be the member states and their public health systems. And this is the most important question from the beginning. Who will pay this reallocation of this sector? And that is why I'm missing, and this is one more topic, I don't know how is the question in the chat, but I think that we forget all this half hour for medicine for rare diseases and cancer, which is very expensive medicines. And there we so need to find solution, because it's impossible for me as an MEP that, for example, the people in Czech Republic haven't or have medicine shortages for some else, and somewhere in France it's possible to buy. Yeah. So that means that it would be if there would be joint purchase of least of this on the EU level, the pressures on the member states can be lower, and we can go for the bigger price or normal or average medicines. It's reality.
We've talked a lot about the sort of the health, the cost efficiency of running the health system, and Dario mentioned sort of the time and the delays to treatment because of finding alternatives and the sort of wasted time in doing that, and the costs potentially going up if we do find that Europe needs to reshore some of the supply chains. Gilles, I wanted to know, as a physician, how aware you are of the cost of the medicines the treatments you're using, and whether or not it's something that physicians need to be paying more attention to. And Dario also mentioned sort of finding ways to improve and sort of cut overuse or unnecessary use of medicines. Is that the way we should be thinking as we find ways to reshore and effectively use what we've got?
Thank you for your question. I can share what has been over the last years and now the situation in pediatric oncology. We have been using mainly off-patent medicines that were in the pharmacist, that were cheap. So the cost of treatment of children was not an issue until recently. Now with the new medicine, there's a real issue because the new medicine costs a lot. And we need to continue to raise awareness of our colleagues about those issues, how the HTA is evaluating these new medicines and how the price is important, really showing what is important from the medicine and what is not important. But again, this is different from a country to another one. in our survey we made, where clearly in some countries, even for the essential medicines for treating children with cancer, in some countries, there was a need for the parents for out-pocket cost to buy the drugs. So again, there are inequalities across Europe. And the issue of pricing is different from a member state from another member state. And more our colleagues, and we are really pushing for that, are concerned about the cost of developing medicine, the cost of care, and the cost of medicine. Yes, indeed.
Sorry.
Yes, come in.
Can I just say that in line with having physicians and patients, you can also use hospital pharmacists, especially the ones that are into pediatrics, so they can really help you with production of pediatric medicines, because we are really have a good cooperation with physicians. So hospital pharmacists are also here to help you with dealing with medicine shortages and having the developing plans for risk assessment regarding these so rare diseases with medicines that are so expensive. So I think you also should, you have to have hospital pharmacists in mind as well to use them as much as needed.
With them, absolutely. We do and work with them to find solutions on a daily basis, absolutely.
Bringing back one of the things that was mentioned earlier in the discussion was joint procurement. And one of the measures that was, we understand, was added more recently to the Commission proposals is to impose that companies or other bodies hold stockpiles of medicines. What are your thoughts on this from the industry perspective, Adrian? And do you think this would help?
Well, I think there are very different aspects to this. So I think there are some good things, like the Commission has proposed, not in the legislation itself, but on some kind of sideshow to the legislation, to have a kind of European stockpile or reserve of reserve antibiotics. So these are antibiotics that you keep only for patients who are resistant to the current standard of treatment, so the current antibiotic. This is actually a really positive step forward, because even for off-patent, older, so inexpensive reserve antibiotics, most member states don't have any at all. And so if they have some kind of issue with a high number of resistant patients, they'll have to go to another country or something like that to find those antibiotics. So I think this really makes a lot of sense, and it's a much smarter proposal than the transferable exclusivity voucher that is also in the legislation. So I think that's a good approach. Where we're more cautious and more concerned is where individual member states would have kind of stockpiles for two reasons. One, this kind of approach then will lead to an oversupply to very big countries like Germany and France, and to undersupply in smaller countries, just because of the impact this will have on the market. So the industry will naturally shift the supply there, and this would be for legal reasons in this case. And so this could be very disruptive for a lot of smaller member states. And I'm not just talking about Iceland, Malta, very, very small countries, but even what I would call medium-sized small countries could be impacted by this, like Slovenia or something. So we need to be very, very cautious there. And the second concern we have is, if nobody pays for these stockpiles, it will be a cost onto the industry. And what that will mean is further consolidation, because somebody will have to absorb the cost. Already in Latin countries, so in France, in Italy, and in Spain, we have about 10% of hospital procurements where no one bids. Okay, that's because the stockpiling or the fine risks with these bids are higher than the commercial value of the bid. So there are just no bidders. And then you have this weird process where companies have to go sell hospital by hospital. It's totally inefficient. So we have to think about how this translates into the real world, when pursuing this kind of strategy.
On the procurement models there that Adrian just mentioned and the tendering, do you think, I mean, you spoke to, or Pierre Delso from HERA came and spoke to the SONT committee recently and discussed joint procurement. Do you think that's a way forwards to try and overcome and provide equitable access to the critical medicines across Europe? Katerina, can you hear me?
Yeah. Sorry, I don't know that it's a question for me. So about the back only short with the stockpiling, because I think that it's one of the positive of in a pharma package, and there is some measures in the proposal that the EMA that can be imposed on the manufacturer, and also as an ultima ratio to create some stock of missing drugs, and it's fine for me. And however, there are all ex-post solution, but occurring only at the moment when a fundamental shortage already exists. But it's fine that is it there, and we call for this. About the joint procurement, can work only on the orphan medicines or cancer medicines. That means super expensive medicines, because on the normal use medicines like antibiotics or painkillers, I think this is impossible yet, because it's very, very difficult to find solution how to do it. So if it will be for orphans and cancer, I will be fine with it, joint procurement, but now we didn't see there. And the idea that the Commission will tender this and send them to one shortage, I don't know. It's if it's okay, yeah.
Daria, do you have a response to this?
Then will be distributed to the member states. Sorry, then will be distributed to the member states from one storage. I asking how we see how it will be in vaccine. So it's very, very difficult. But maybe my colleagues tell me that it's possible.
Yes, maybe Daria, you can enlighten us.
Yes, it's really, as you mentioned, it's really, really difficult to do joint procurement, as from one country, for instance, Croatia, which is not so big country, we had difficulties. But I think if we join forces, and the pharma legislation can help us with that, because while as we mentioned all the time, all member states face shortages. The shortages are not the same in all member states. Okay, there are exceptions, like we had antibiotics, but for instance, in other countries, you may run up of epileptics or thrombolytics or some medicines like this. And by helping each in acute situation by each other, by having some mechanism that can help us, we can prevent patients from facing serious consequences in Europe. But this is also regarding, in my opinion, we can also have the same mechanisms of some kind of joint procurement. Is this critical list of medicine that will come out in autumn is one way to deal with the problem of shortages, and this is a good way to start. So we have to all join forces, in my opinion, maybe to have a real world registry that provide insights into the actual comparative effectiveness of approved drugs, as well as the long-term cost effectiveness of these drugs, in order to ensure that effective medicines are on the market, while, for instance, non-effective are withdrawn from the market, and therefore making more product lines available for medicines in need, such as antibiotics, for instance. These are some of my solutions, proposals, sorry.
I think, yes, definitely. And they are very interesting. I do go quite beyond what we've seen in the pharma package so far. And Gilles, I would love to hear your response to those.
Yeah, thank you. I was just mentioning an initiative which is at the moment being implemented at the global level, because we're talking about shortages in Europe, but there are shortages as well as completely outside. In the field of pediatric oncology, it's important. So just something which is, I think, interesting to think of. The World Health Organization is running a global initiative on childhood cancer to increase survival of children with cancer over the planet. In this one, there is improving access to the essential medicines. And there is an initiative which is being set up, a global platform, where there will be funding in partnership with St. Jude Children's Hospital in the US to really buy the essential medicine and provide these drugs to the countries needed them, which I think is a kind of procurement, which I think if there is a big order for anti-cancer drug in a rare population, there might be less issue of shortages. So it's an initiative which is piloted at the global level, but which might be a kind of concept about the joint procurement you are discussing. And I would really agree with the MEP Catherine. Can I say MEP Catherine? Catherine, sorry. Clearly focusing on the orphan medicine, where this is a big issue of access to the approved medicine across Europe. For solution for this small population, joint procurement can be one important solution. Thank you.
Thank you. Adrian, I'd love to get your reaction to that, much more of a global procurement in certain areas. How would industry manage that kind of approach?
Yeah, well, our industry does actually work with the WHO on some of these projects. So up until now, the WHO is focused much more on infectious diseases. And I think there are two components to this. First of all, the WHO has a regulatory procedure to approve the medicines to ensure that they're safe, quality, and efficacious, which is super important in a lot of, let's say, less regulated countries where you don't have a good regulatory enforcement for the pharmaceutical sector. So this is really, really critical. And we work a lot on that process that the WHO does. And actually, it's often European regulators from European medicines agencies, usually national agencies, who do the approval and the quality control checks for the WHO. So it's really a good process. And then secondly, there are other bodies that kind of support the WHO, like the Bill Gates Foundation or other charitable organizations that then provide actual funding. And so you can have procurement there. I think one of the differences of these global initiatives for joint procurement is that basically you have a standardized packaging and agreement on the drug, et cetera, when you do this. So it's relatively simple for the companies to produce for these joint procurements. In Europe, that's kind of straightforward for products that are approved, can be approved centrally. This is the same packaging and stuff like that. Some language stuff need to be solved. But it's harder for some older medicines in Europe, because for older medicines like antibiotics in Europe, they're actually licensed nationally. So they're with these old licenses that are not European, but national. And sometimes even the dosing is different. So across Europe, different European countries, they don't prescribe the same antibiotic doses. Even like, say, Norway and Denmark have differences. So you can imagine, I don't know, differences between, say, France and Holland would be even bigger. So we have some technical problems of non-harmonization that still have to be worked out there, I think, before we could apply this kind of thing inside Europe. So I'm a little bit more skeptical there, but definitely for the global side, there's opportunity.
Irony that it's easier to make it available to the global population than even the European population. Katerina, thank you. Come in.
Sorry, just only a short react on it. Well, project of the WHO are, let's say, nice on the paper, but let's keep in mind, colleagues, they have not been even able to distribute justly the COVID vaccines and treatments, and to the global south or the poor states. I think that so the idea that they would be able to that in a bigger scale with antibiotics, painkillers, etc., is basically a dream more than reality. But now we stay before the crisis in EU, and I think that yes, it's nice. Idea worked. It will be great. But in the other side, if I remember how it was with the vaccines and treatment against the COVID, I don't believe it, this solution.
Thank you. I'll just bring in one more question here from online. It's from D. Breyer at BPI. He says, or she says, if you had one wish to ensure the care of European patients while keeping pharmaceutical innovation in Europe at world level, what would that be, and to whom? So who would like to come in on that first? Gilles, perhaps?
But are we talking about innovation or are we talking about shortages of well-established drugs? It's not clear to me.
One wish to ensure the care of European patients while keeping pharmaceutical innovation in Europe. So maintaining care.
I think it's a question about the general pharmaceutical legislation proposed by the EU rather than directly focusing on the shortages. Maybe I didn't understand the question.
It's not very clear, you're right.
Okay. Okay, so do we start discussing the proposal by the Commission?
Well, I think if we keep it, if we keep it restricted to the point about providing the medicines that patients need in terms of the shortages that we're facing at the moment.
So shortly, if we stay on providing all European patients access to the essential medicine they need for their health, especially in the rare disease field, especially in the life-threatening disease. Clearly, I believe the initiative at the moment of the EU and mobilizing the member states with all the measures can really help. But we need to focus on that, which I think is a different thing as providing access to innovation for all patients, for those who are not being cured by the treatment we give at the moment.
Thank you. Would anyone else like to come in? Adrian, you're nodding.
Yeah, no, I think as Professor Vassal has pointed out, a lot of these medicines for population level health are actually already off patent. So, we should really leverage the legislation to make sure that all the patients can get access there so that we don't leave people out on a very large scale. I think this is no longer acceptable in the EU to have these huge disparities, especially when we can easily solve them. So I think that's certainly the case. I think certainly some of the innovations or some of the challenges that we're seeing is that there's a high expectation that the industry is going to innovate and bring new treatments. I think that's going to continue to be the case. We have to solve also this issue of rare diseases. There are 5,000 rare diseases, so that's a lot of medicines developed. One of the things we can do is more repositioning, reformulation of existing drugs for some of those, because that's kind of more affordable. That's one part of the solution, not the only solution. And so I think, there's a lot to be done. And what I would plead for in this legislation is that we actually really think about how it's going to work in practice in the member states, so the patients benefit from it. So it's not just a paper promise, but a real promise where patients who need those medicines get them. That's what I'd like to see.
Would anyone else like to come in on that question?
I would just say again, reiterating. Sorry, you can go, Katerina.
No, it's yours. I have an opinion.
Sorry, I'm sounding like I think that my only wish is to have a real collaborative approach, to look from different angles and then to come up with the best solution. But this is, of course, ideal situation. So we can have every patient as an individual and we can treat him as an individual. So this is some ideal case. So we have a multidisciplinary approach, like during the rounds we discuss on patient and then we come up with the best solution. So this is one of the ideal wishes that the question was asked. So I'm just okay. That's me.
And Katerina?
So I want to just in the end want to be positive. So that's say that the pharma package is a good start of the work, which will take more than next debate. Yeah? And before us is definitely needed changes. The EU primary law. This is a so huge question. Yeah, we often hear from the EC and last time of Ms. Kyriakides in the NV that they cannot do anything with the affordability since they do not have powers to do that. And we need to really speak about the patent law and maybe change some figures and concerning the years of the protection. And we have to really come up with some solid, stable framework for the joint purchase of the expensive medicines, because here it stands.
Thank you. Any final comments? No. I have one final question actually for you, Katerina, and that's really on the timing of the legislation and the proposal from the Commission. We obviously have European elections next year and for the European Parliament. And, you know, what are the chances of having a European Parliament reach a negotiating position before it has to stop work, let alone the legislation being finalised before the end of this Parliament?
It's very, very difficult to say, because I don't believe it, because we have now opened some another medicine files, for the SOHO, HDS and so on, and it's very important and big issue. Yes, we are preparing to start the work about this pharma package, but in the other side, maybe we ended the first reading. But after this, after elections coming, new colleagues or new members will be here, and there is a question if we'll be agree with our position or we want to start a new debate about all these things. It's very, very difficult, and I'm in these things. I'm from small group. It's maybe sometimes asking the EPP and SND colleagues, because it will be in their hands mainly. Then in our, we are preparing in Sant, we are preparing in Envy committee. I think that working on these topics, the same people last 10 years, so that we know what we want, how to do it. We have many declarations and non-papers about it. But how will be situation? It's very difficult to say. I think that the rate will be if we ending the first reading, but I don't expect it that we will be 2 months before election in trial.
Thank you, everybody. That is all we've got time for today. I think it's been a fascinating discussion and a debate about the very complicated topic of ensuring the and solving the problem of drug shortages in Europe. In summary, I definitely feel there's the feeling of relief that the European Commission has stepped in at last to try to solve some of these problems, especially defining what critical medicines are and finding a way to monitor those in future. And having better communication between each of the actors involved. We need to make sure we don't miss out doctors and patients in that communication as well. There's broad support, I felt, on the joint procurement, and also strong support, I felt, for rebuilding manufacturing in Europe. The council report or non-paper that came out earlier this week seemed to have full backing from the panellists here today, which was calling for a Critical Medicines Act that would support the reshoring of medicines and the resiliency of supplies in Europe. Finally, before we go, I would like to take a look at the results of the poll. We asked, which policy measures would you prioritise to ensure security of supply of medicines? And the results are in, and the top answer would be open dialogue on market needs between manufacturers and national regulators came in at 50%. 36% said that new pricing policies and tender reforms to prevent generic consolidation would be next. Next, we have at 33% allowing faster movement of medicines across medicine supplies across Europe. And in at 29%, we have access to EU funds to secure essential medicines in Europe. I'd like to thank our speakers for joining us online, and I'd like to thank the audience for your interest today. Thank you to our partner, Teva, for making this event possible. Please do send your feedback. Check our website for events updates. We have a great lineup for the year, including the Healthcare Summit, which takes place this year on October the 24th and 25th, and we hope to see you there. Thank you for joining us. Goodbye.
This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.